Okay, I gotta get my chat open. All right, we are live. Okay, hey, there's David. Welcome, David. Good to see you. You're on mute, by the way, so that's
there we
fine.
Go. Hi, how are you?
Good. Hey, good to see you. Well, welcome to everybody to Plan C Live. This particular edition, we'll be talking about California's Central Valley, which if you know nothing else about California, it's where most of you get your food. And it's the other valley, not Silicon Valley, but the Central Valley. Joined, of course, Dorothy Jones-Davis as co-host here, Nation of Makers. We have Nabil Kaji and from Stockton, Karen Warren from Modesto, and also David Martin from Modesto Junior College. We'll be joined by, I think, one other person, but we'll get started nonetheless. First of all, to anybody listening, I'd like to thank all of you. David was there and who participated in Virtually Maker Faire last Saturday. It was really amazing to see the different stories from different people and learn more about what makers are doing around the world, particularly in this time of COVID-19. So thank you all for participating. And, you know, the archive's up there. It's like 150 to 200 sessions, amazing, you know, sessions to explore still, even after they were recorded. So let me introduce Dorothy Jones-Davis again. And NAMCON is the next maker event on the calendar, and she's going to tell us about that.
Yeah, so NAMCON is our annual leadership conference. If you're a maker leader or anyone who is engaged in the maker community, we invite you to come to NAMCON. We are excited to have over 60 sessions that will be happening, and it's really a chance to dialogue. So at Virtually Maker Faire, we started a really great conversation across the globe, and we're really excited that June 3rd through 6th, if you go to namcon.org, so NOMCON.org, you can find out all the information about the sessions that we're having, and we're inviting everyone to come and really continue that conversation. Our theme this year is sustainability, building and supporting an ecosystem that sustains us all. And really, there's not more of a timely theme, really thinking about how we take care of our earth, how we take care of each other, and how we can continue to sustain the work that we're doing in our organizations near and far. We have lots of engaging folks joining us, lots of engaging sessions. I could go on, but I'm sure Dale wants us to get to the crux of this amazing conversation about the Central Valley. But we really encourage you to come if you can to NAMCON. Again, that's NOMCON.org, and I'll put the information in the chat box. Hope to see you there.
Okay, thank you, Dorothy. Well, we're going to just lay out this today. I'm going to actually ask Karen to give us a little bit of a profile of the Central Valley. She is Congressman Josh Harder's district chief of staff, and she's located in Modesto. And then we're going to, after that, I think we'll talk to David Martin about Modesto Junior College and the printing PPE group there. And David has an award ceremony, I think, later this hour.
Starting at 5.
Starting at 5. So we're going to put him at the top of the agenda. And then we're going to go to Nabil Elazar and others to talk about the PRINTtoPROTECT Coalition and learn more about these different efforts. So Karen, could you give us something? You're someone that grew up in this area and know it, that you were saying. Maybe you could start by explaining the picture behind you.
Sure, yeah, absolutely. Hi, everyone. My name is Karen, and as mentioned, I grew up and was born and raised here in the Central Valley. I work for one of our local members of Congress, Congressman Josh Harder, who represents the California's 10th district. He and I both grew up in Stanislaus County, and our district covers all of Stanislaus County and then part of San Joaquin County. So I'm based in Modesto, and the picture behind me is a photo of my childhood backyard, which is in a small town called Oakdale in Stanislaus. If folks drive from the Bay Area to Yosemite, you drive right through it. And it's representative of a lot of our district. We're a very agricultural area, and the Central Valley is both one of the fastest growing regions in the state as well as in the country, but it's also one of the most low income. We have over 40% of the population in the San Joaquin Valley or the Central Valley is on Medicaid. We have extreme, very serious issues with healthcare access gaps. We have some of the lowest ratios of doctors and medical professionals to 100,000 people in the state. And again, even in the broader country, we have really serious challenges in the Central Valley with healthcare access as well as other socio and economic determinants of health and other outcomes. And so, the COVID-19 crisis has really hit our area hard in a way that I think a lot of people wouldn't expect of a more rural area. Although we don't have the urban density and some of the challenges with disease spread that you might find in San Francisco, or certainly as we're seeing in places like New York, we have a community that's, when there's a challenge, whether it's a healthcare challenge or an economic challenge, when it comes to our place, we're really heavily hit because we already have some serious, access gaps when it comes to resources and other things. So I'm excited to chat more about some of the partnerships that we've developed to address issues like PPE shortages for our healthcare professionals and other first-line responders. But we're really proud of our community and the way that it's stepped up to address the needs of our local residents. And I'm just grateful to be here with all of you. So thanks for that invitation.
Thank you. All right, David. So tell us, you are a professor in anatomy or biology at Modesto Junior College, and how did the signal get to you that you needed to do something?
Well, yeah, I kind of wear two hats. I'm in both the biology department and what we call the APM, which is Anatomy, Physiology, Microbiology department. I'm actually head of the cadaver program here, and just to put it in context, MJC has the largest undergraduate cadaver education program in all of Northern California. So it's a huge facility. It's only 3 years old, and it's the best around. We have relationships with all the surrounding institutions because they don't have cadavers. So a lot of their students come to us to get educated, from UC Merced, from UC Davis, even from Berkeley, Stan State. All these other institutions come to us. And the folks like in Delta and Stockton, they don't have cadavers there either, so they come to us. Most of our students either want to be nurses, dental hygienists, physician's assistants, and then we have about 10 per year students that want to go to medical school coming through our program. And they come here because of the cadavers. So anyway, all that to say, I've got a lot of students that are going into medicine, and I've been doing this for a while. And so what happened was it was early March. A lot of my students, both students that are current, that are working as like a CNA or, nursing assistant or medical assistant, whatever, as they're working on their requirements to get into the higher programs, they came to me and started saying, hey, this COVID-19 thing kind of scares us. What do we do? Because PPE is not available. And then pretty soon, some of my past students started coming in, including students. I've got students at the ICU and CCU that work in those departments at Doctors Medical Center, which is the big medical center in the Central Valley. That's where everybody goes. It's a level 2 trauma center, which is now in process of going to level 1. It's the only one from Davis all the way down to Fresno. So we got a lot of COVID patients. And the result was there wasn't PPE. In the Central Valley, the masks don't seem to be a problem. The problem has been the face shields. I've also worked with people, because I have contacts all over the Bay Area as well, but I also worked with several hospitals out in the Bay Area early on, because they, of course, got slammed with COVID-19, and they were asking for anything I could do. They were asking for masks. So I printed some masks. Masks are not something that 3D print well and fit well in order to meet the requirements of the hospitals. So we grabbed the DTM3, which is the PRUSA plan. It's the one which has the bill that comes up like this. And that was the first one that was accepted by the NIH as approved. The problem is it uses this connector right here for the buttonhole elastic. Well, the problem is when we put them into service in the hospitals, the buttonhole elastic can be used once and has to be thrown away because of infection control. This stuff is kind of expensive, and as most of you know, darn near impossible to get now. So that became a problem early on. what a lot of folks were doing is they were using some elastic stuff, Coban, and then hooking it on there, but it doesn't stay on too well, and that causes a problem. So we started looking at other designs. The other thing is it took 12 hours to print one of those things. So we started looking at other designs, and that's when they came out with, and I can remember the name of it, but it's the second one that Prusa put out that doesn't have the bill on the top. And now they've got a piece that drops into that to fill that gap in the top. But another one out there is this one by UCSF. And it's fairly similar to the Prusa one, but it doesn't have the ears on the side. Instead, the bow comes out and it connects to it. You still have the flexibility, but it still has, you know, the buttonhole elastic and these little knobs here. Let's see if I can get this. There we go. That are a little bit harder to connect the plastic to. So you go like that. So it had some pluses. It's fast. You can print one of these in about 35 minutes, but you get the overtopping when you put the face shield on. You tip down when you're intubating, and the particles, the viral particles overtop is what we call it. So that didn't work. So we came up with our own design. The first one was actually this one right here, which you notice. Let's see if I can do this. You can see the hooks. That's for the Coban, so that it hooks better on the Coban. We went to a rounded configuration. Oops. Sorry, this thing is backwards, so my Modesto doesn't look backwards. So it's a little confusing.
Yeah.
But we did that at an angle so that the plastic stretches across this. But with the solid, it doesn't flex, and it felt like a brick on the head. So we tossed that. We did one that was open, but of course, the first complaint was the overtopping. So this was our solution. This is the MJC design that incorporates all of that in it that we used.
Yeah, David, when we say we,
oh yeah, I'm sorry.
Who else is involved in this?
So I started it back in March,
right,
and pretty much was printing everything I could because I have one 3D printer,
right,
and I was way overwhelmed, and I put the word out because there's other 3D printers on campus. But by the end of March, we were shut down and everybody was at home. So I took my 3D printer home.
Exactly.
So I had to go through the bureaucracy of getting special permission. And that's when the computer science folks came in, and they had 3 printers that we brought on board. There's a school group that I kind of advise that's the engineering club, and they had a 3D printer. So I got a hold of those students, got that printer. And then we had a student of Randy, and I should list this out. Randy Thor, he's a he's the materials sciences and manufacturing, industrial sciences instructor, and he does CAD and CNC machining instruction. And he has a personal 3D printer, a small one, but he also, you know, has the ability to 3D print. So we got him 2 of the printers out of the computer lab. And Adam Brava, who is the technical assistant in the computer lab, he joined up, and he's got a couple of maker bots at home. And then he gave me another Ultimaker printer, so I have 2 Ultimakers, and he gave Randy a Markforge. And then Chris Vaughn joined, who's a professor of computer science, and he actually has 2 3D printers at home. And then one of Randy's students has a 3D printer. And then Chris Vaughn was in contact with Bree Palmer, who runs Downtown Tinker Tank, which she helps get basically, you know, tinker spaces in schools. And she's an alumni of MJC. So she joined in with her 3D printers.
Yeah. So you really had to build out your network. Literally,
yeah, it took about a month and a half to build out the network, but we now have capacity of about 300 face shields and 300 ear savers a week.
Wow.
Consistently. Okay. And that's assuming that 1 or 2 printers has a problem at any one time, because there's always one of them that's down.
So are you printing just one design, or the multiple, still printing multiple designs?
So the DTM3, we've modified that one so that it has this type hook. Yeah. And actually we've made one more modification. Let me show you really quick. This is the latest design, and this is what we're printing now. If you notice, we added a back hook, and that's because when you wear it, what they do in the hospitals, they wear the N95 mask and then an ear loop surgical mask over that. That causes the elastic to stretch over the ears. It injures the back of the ears. So with this, they can hook that the ear loop mask over the top of the face shield instead of, you know, you guys have all seen these. We print these by the hundreds, and everybody loves these, but it's one more thing to have on your head. So we try and get rid of this by adding that. And so that's the big design change. And this is what we're printing now.
So,
We
David,
print,
yeah, could you talk a little bit about the interfacing to the hospitals and and the healthcare professionals? Like, how did you get that to them? How did you get feedback from them, and continue that sort of loop?
yeah, you know, it's interesting because if you go at the hospitals directly, they just reject you out of hand. They're not even interested. But because I have students that work at all these medical institutions, they come to me and they say, hey, what's the deal? I say, okay, what about this? They take it into the hospital from the inside. They show it to the supervisors and everything. And then it's the greatest thing since sliced bread, and everybody wants it. And I
That's
got
great.
in with ICU, CCU, and the emergency department
Yeah.
that way. And then word spread within the hospital. But if you come at it from the outside, and I will, this is the one political thing I will say, is that hospital administrators tend to be along the Trump line of thinking. And they think the whole thing is kind of ridiculous and not a problem. And that seems to be what I'm running into in the hospitals with administrators. So if you come at it from the medical profession side of things, they push from the inside out, and that's how we get in the door.
That's great. Well, that's great. Let's maybe I'd like you to hear a little bit from Nabil too, because you guys could connect. And why don't you tell us, Nabil, how Print to Protect got started and your coalition, another kind of network that you built?
Definitely, David. Thank you for sharing your story. I definitely look forward to connecting afterward. You know, I'm a practicing dentist in Manteca, California, and we started to notice our PPE was starting to be rationed in January. That was sort of
across the county or just within
our ability to order PPE.
Right. Okay.
We were only able to order them in smaller batches, and when at the time when the shelter in place order came down, we were already ready to limit our operations. I started to get concerned when I started seeing the protests happen with nurses in Modesto at Kaiser. They were also happening in the Bay Area. And I just thought to myself, if we're this early into the fight against COVID-19 and we're already short on supplies, we need to do something. And as Karen mentioned, resources in a general sense are limited in the Central Valley. And if we're all going to be fighting for PPE supplies as a country, then I think it's time that as individuals in the area with manufacturing capacity, we step up to the plate. So I knew I couldn't do it alone. I have 3D printers in my office, but this is not a one-man task. This is a community effort. So I immediately began reaching out, and I looked at, who are the, who could help us make PPE, but then also we need to make sure that whatever we make fulfills a need on the front line and gets to the front line. And in this time when we're all isolating, how do we do that? So I looking at manufacturing partners early on, I looked at, being based initially from Stockton, who are the most likely partners? It would be the university system, University of the Pacific, we reached out to immediately and they came on board. Maker Spaces reached out to Elazar, and he'll share his role later, immediately came on board. School districts, the public library system, and we just started building, adding on partners, and I can't wait to talk to David. Mm-hmm. From there, I started that work, and I received word about the Central Valley PPE initiative, and it's and how they were starting to organize across this 3-county area: San Joaquin, Stanislaus, and Merced, and sourcing PPE. So I sent a message to them, and Karen reached out to us. So we put our heads together, and initially we wanted to know what should we make, because to undergo the time to make something distributed, we need to make sure we're printing and manufacturing to a need. So with Elazar at the Hatch Workshop, University of the Pacific, we put together an item of a menu, essentially, of items we could produce, from a respirator mask to face shields to ventilator valves if we need to. You let us know what we need to make. And we submitted that to Karen, And Karen was able to take it to the level of emergency services in the 3-county area. And we got word back, we need face shields, and 10,000 would make the difference. So now that we had our marching order, that's what we've organized around, and we've had a laser focus. So I look forward to, so we're continuing to onboard more folks. We have an R&D team set up, which I'm really excited about the work that David's been doing as well. That's been vetting designs. We initially started off with the UCSF design and found a few flaws. So now we also have a clean sheet design. We also borrowed from other coalitions, from hackthepandemic.co.uk, from Project Hygia in Brazil, looking at their designs to dial them in. So because we're organizing across the Central Valley, we have a middle school teacher in Merced. We have laser cutters in Berkeley working. As soon as we have updated design files, we basically update a Google Doc, and then they have the latest design file to print.
That's great. That's great. Thank you. Well, Elazar, tell us a bit about Hatch Workshop and how you got involved working on this project.
Absolutely. Thanks, Dale, and thank you all for sharing your stories. And it's a pleasure to be here. An honor. Hatch Workshop is a nonprofit makerspace in downtown Stockton. So we have a focus on wood, metal, and ceramics using digifab tools, different processes and techniques. So under normal conditions, we have a makerspace program. We have classes, we have events. When everything started to hit the fan and society started shutting down, we closed down our operations and quickly realized that, we were positioned well for the manufacture of PPE, but we're a young nonprofit. We have, one laser cutter. We have, 2 3D printers. So it's enough to do something, but not enough to make, the difference that's required.
Yeah, not 10,000.
Yeah, exactly. So we got connected to Nabil just as he was starting to, get the search out through the grapevine, as it always goes. And Nabil gave me a call, and, within a few days, the coalition started to emerge, and we got a big donation of plastic from the Bay Area. Maker Nexus was so gracious to give us 5,000 kits so that we were able to, use some plastic that was donated through Coca-Cola. And it's just like, it's been this amazing thing that we have the facility to, receive materials, receive volunteers, everybody's socially distant, wearing gloves and masks. And, we're able to bring the ability to make a difference to everybody here in our community.
I want to say that Coca-Cola donation was the best thing, and this is not an endorsement of Coca-Cola, but I think I've heard so many makers. I'm really impressed how that one donation touched so many efforts, and we just keep hearing about it. So I just kind of urge other companies to really think about the impact that they can have through a very, very generous donation.
Yeah,
absolutely.
Karen, can you join us again here and give us your perspective and how you both saw the need arising and reaching out to groups and talking to people? I think it's an impressive response from people wanting to help. And I think even from a government perspective, I think our government needs to do a better job of understanding how to leverage the resources and talents that are in their own communities, at a junior college, at, a nonprofit makerspace, at, a collection of homes that have 3D printers. So I'd love to hear your perspective on this.
Absolutely. Well, one of the first things that started happening in the very, very early days of kind of some of the first positive cases in the US, when it became clear that this was going to be a really serious major issue, we started getting really immediately calls from healthcare workers to the congressman's office, and people very, very concerned and about kind of what was coming and preparations. And then that quickly evolved into people calling sometimes in tears about their concern about the shortage of PPE at their workplace. And so this ranged from, nurses at acute care facilities to people in skilled nursing homes and other types of frontline workers and essential workers. So to be honest with you, one thing that's sad and frustrating through this is that we're continuing to get those calls still today. It's gotten a lot better as the response has kind of jumped in, and we've and this initiative has been a part of that. But really, those frontline healthcare workers were the ones who initially really kind of rang the alarm bell. And we certainly started seeing all the news stories out of other parts of the country as well around PPE shortages. So obviously, there's kind of at the one level, legislative responses to this that have been essential in opening up kind of the national stockpile of PPE, which then is, moved to the state and then brought down to the county level. But we saw very quickly that there was a need to move faster than we were moving at the national level to address immediate concerns and supply gaps. So we kind of, we're seeing those frontline issues, and then started reaching out at the local level to then try to understand the supply chain and what needed to happen to get those supplies to frontline workers, and quickly got plugged into the emergency services structure at the county level, which plugs into kind of the state system. And the reason we decided to work with our county offices of emergency services and emergency response is that they're basically triaging across the community. So they're getting supply requests from all of our hospitals, all of our healthcare providers, our nursing facilities, et cetera, as well as our first responder agencies. So police, filing all of these requests, looking at the supply shortages and needs across the community, and then trying to fill those gaps both through the standard channels, the big kind of stockpile that's moving through from the national to the state level and down to the counties. But then, they're looking at where are other ways that we can fill gaps to meet those needs. So the congressman decided to launch the Central Valley PPE initiative to try to focus on what are these creative kind of gap filling opportunities that we can identify locally and regionally to move faster than we're moving at a federal level at this point in time. So that was kind of the start of it all, and people really got on board really quickly, and we moved from there.
Yeah,
I'm sorry, I think you wanted to.
That's great. I'm just going to ask that I think to some degree there's an urgency in rural areas that sometimes healthcare workers feel like they won't get what they need, that they're waiting in line behind larger metropolitan areas, and to some degree hospital administrators aren't helping, by making them confident that they'll be getting that they have a plan for addressing this. So I think that's why they reach out in desperation, because they feel unheard and they feel vulnerable being in a rural area.
Yeah, and I think that there's, I really applaud Representative Harder and sort of standing up in this way, because I think, we have seen that, in some ways the federal response hasn't been what we expected it to be. And really the local response is on all of the theme throughout all of our shows that we've had and every group that we've talked to is really this local response. And I think having our representation in terms of our congressional leaders that are, standing up for us and actually, showing that they are in terms of, starting these types of initiatives and being in touch is really, really meaningful. And I think, I personally, for wearing my Nation of Makers hat, we're always very, very excited about policy and really thinking about, the types of policies that can be made and how we think about the people within our community that are resources, and how do we leverage all of the strength that our community itself holds. And so I think, it's really exciting to hear you say, I'm excited, about the response that you guys have taken, and the fact that you are partnering with groups like Nabil's and probably soon to be David's and other groups that are in your area to help meet that need. And some of it, to Dale's point, I think there is a different urgency in rural areas because the rural areas are often left out of sort of the larger scale sometimes. And although I think there are lots of groups that are trying to change that, I think there might be more of an urgency to work together. But I actually would love to get that spirit to every part of the country, because I do think that there are some communities like your own where it's working really well. And then we see other places where people are not, either the representation doesn't understand what the maker community is able to provide, or perhaps there's just a disconnect in understanding between the communities. So I really commend you guys for the work that you're doing.
Yeah.
Well, thank you. I mean, one thing I would highlight is that I think a lot of what our role has really been play matchmaker and a bit of an information clearinghouse, because there's often a disconnect between the capacities and resources that are available in the community, either super locally, as we've been seeing amazingly with our partnership with the Print to Protect Coalition, or at a regional level. So one of the kind of early successes that we had was because we kind of had set up this initiative where people could contact us and we were kind of aggregating demand. We heard from folks. So that Coca-Cola donation, initially was flagged because we were doing outreach through this initiative to kind of find any sort of resources, and we were able to connect then this, corporate donation with this initiative that we knew was happening locally that could make really great use of that plastic. But we've also, we were able to plug into some of the corporate initiatives around PPE that sprung up in the Bay Area. For example, Donate PPE ended up connecting us with 30,000 surgical masks pretty early on, and so we were able to deliver some at a time when surgical masks were also critically needed. There was actually an acute shortage the week that we delivered those in our area. And they told us, we have great connections here in the Bay Area, but we really want to know where is the need elsewhere, and we just don't have those connections or really,
Right.
And so there's sometimes kind of just that synapse that needs to happen between where is the need and where are the resources that can be brought to bear.
Let me just echo a comment from Catherine Falk is cutting out face shield pieces while watching this. Welcome, Catherine. Nice to have you join. She says, it's nice to see everyone get more attention for this important effort. So, it's important what everybody's doing to contribute here. Karen, it's not just the hospitals that need PPE. Some of the demand is because this is going out into all kinds of other elderly care facilities and such, right?
Yeah, that's exactly right. And actually our nursing facilities or long-term care facilities are one of the highest priority and most vulnerable population groups. And I think it took us collectively, and I think this is nationwide, a little while to realize how urgently they needed to be prioritized, because it's about reducing spread, especially in these really vulnerable populations. And the governor and other leaders have really made quite a point of making sure that is a big part of the strategy at this point in time and moving forward. But that was absolutely one of the areas that we identified earlier on. We were hearing from workers, working with folks who are 70, 80, 90 years old, who are saying, we're worried because we don't have basic masks for ourselves and for our patients. And so things are getting better now, but that was definitely an acute issue.
Yeah. David, if I might throw it to you, because I'm not exactly sure when you have to leave, but I'd like to, yeah. So based on what you've heard about, from the others, it's an interesting thing is, like, on one hand, to build coalition, you have to allow people to do their thing, and like Catherine on a couch making face shields, and yet connecting them together is very powerful. So, I just like to offer you to give your closing thoughts or remarks there.
It's tough because, we got shut down at the college.
Yeah.
So my classes are all hands-on brick and mortar. So all of a sudden I'm taking hands-on brick and mortar classes and turning them into, Zoom. That takes a lot of time and effort. And that was happening at the same time as the PPE. And there's the bureaucracy and all that, because our program, the college basically lets us use the 3D printers, and then, private individuals have 3D printers, and the college basically opened up the store of filament, and we've been using that. And the foundation for the college actually has kicked out with $2,000 to help with expenses. But up until now, basically, it's kind of been out of pocket.
Yeah. And it is kind of interesting that a lot of these universities and others are, they are shut down. So it's museums, even maker spaces are
I had to get special permission to come in today because I'm doing this award ceremony. The internet, and by the way, I live in Oakdale too. Internet is a little dicey out there because I'm on the far side of town, and it gets a little dicey out there. So I had to get special permission to come in because I'm the one that's actually doing the PowerPoint today. So that's the only reason I'm here. Yeah. But the college has been funding us. They've got it set up where people can donate to the foundation, the MJC Foundation, for our efforts. But the problem is that between doing all of that, I haven't had time to reach out. I had no idea that Neville was here, or even that Josh Harder had a thing going. I had no idea. We were just running full steam ahead and haven't been able to look back, because I'm running 2 3D printers 24 hours a day. Every 2 hours you're up changing the 3D printer. And with that in classes, it's exhausting. So I'm glad we've all been able to connect. I put my contact information up for you guys, so please contact me.
Thank you, David.
I do want to tell you, though, one last thing before I really need to go. We started out doing hospitals. Doctors we've covered pretty darn well. We've done quite a bit with Memorial. We've done quite a little bit, I should say, with Emmanuel. We've also reached out to Kaiser, but Kaiser, apparently they're in pretty good shape. And then there's one other hospital, can't remember. Anyway, we've been taking care of them. And as they need, we've taken care of it. There was a group of doctors that left here, went to New York. We actually supplied PPE for them to go to New York. And I've now supplied almost 200 shields to New York and another 50 to Connecticut. Also, we got a call from the California Veterans Homes, and we supplied them with 200 sets, and we have an order for another 200. They actually would like more, but I'm trying to get all the local nursing facilities and all that's covered now. And I think we're at 600 to local nursing facilities, but we still have about 400 to go before I think we're in good shape with the ones in Modesto and the surrounding areas.
David, you made a comment on Saturday that I kind of remember. I think it was you anyway. That he said, it's a good thing I didn't listen to all the people who said there wasn't going to be an ongoing need for PPE.
Because I went to the hospitals, went to the administration, and got shut down. They basically didn't want to hear about it because it wasn't produced in a certified factory with sterile this and that. And I said, okay, look, we're following NIH guidelines. We are following the disinfection procedures. We have the CDC and NIH guidelines written in, because I have a whole booklet that goes with our masks, or our face shields rather, that explains to them how to put them on, how to don them, how to doff them, the links back to the CDC website, and the NIH recommendations, what the approved disinfectants are, how it's done, how we package them. I put all that information together, and they just weren't interested. But shoot, I'm trying to remember. Memorial is with somebody health group, and they passed a deal within their own organization that individual employees could provide their own PPE. Once that happened, boom, we slid right in and supplied it to the people on the ground and filled up the hospital.
That's great. Well, thank you, David. I really appreciate your contributions today and much of what and everything you're doing. It's been good to meet you over the last week, and let's stay in touch.
Good deal. Thank you. And I'm going to quickly write down numbers and stuff, and I've got to go, but I put my email and phone number up for you guys. Please send me an email so we can connect, and we'll talk later.
Thank you.
Thank you.
Thank you, David.
All right. Now, one of the things, being a dentist, that I've heard is that dentists needed PPE to get back in business, and they were kind of restricted from using existing PPE because it would take it away from healthcare workers that needed it more than the dentists. So has this applied to your business or your group of people, fellow dentists?
Yes, early on in the, it was actually very shortly after the shelter-in-place order, the California Dental Association had an emergency stockpile of N95s that was seized by the state and redirected. So, as dentists, we, as a community, we limited the cases to emergency cases. For individuals in pain, in infection, to take to be able to take care of them. And for the far majority of dentists, we found ourselves with basically the inability to access N95 masks. So that was a great hindrance to even for the far majority of offices to keep open. For that reason, on a nationwide level, 60% of the dental workforce has been furloughed or laid off.
Yeah.
So it's going to be an interesting recovery both for us locally, in the Central Valley, as we slowly get different pieces of PPE and equipment that's needed to get us back to this new normal of operations. So, it definitely affected dentists early on and continues to do so.
Yeah. Elazar, can you talk a little bit about you're a maker space? Thank you, David. That nonprofits, relatively small, and you don't have an institution behind you that's saying, here's all our filament to use, or you're kind of probably volunteer run for the most part. So talk about, that's kind of a difficult balancing act, isn't it?
It can be, but at the same time, when the situation hit, everybody got put in very difficult situations. And
Yeah.
we, as a makerspace, we had to close, but that still left us with equipment, left us in a very actionable place. So once we were able to start, once we got connected with Nabil and this coalition started to emerge, the coalition has been able to receive grant funding that's, greater than we would be able to receive as any of us as individuals. And we've been able to leverage those towards materials and things to keep this party going.
Oh, well, that's great.
As a nonprofit, it's really just kind of, as we've talked about, leveraging assets in the community to, make a difference.
Because it is, to use Dorothy's theme from NAMCON is, one of the things that I think I'd love to come out of this is, what does sustainability look like for these spaces, this capacity of our communities to respond to emergencies? We have had models of this in the past, but I think we've let them, go into the past. But this is not the only emergency we'll face, and then climate change and other things are going to impact, especially the vulnerable aspects of segments of our community more than the rest. And I think it's hard to do some of the response on a federal level, even a state level, and I think this local level is really important. Can you talk about how, those are just some of the people that you've connected to through this, that you're through your makerspace, and people that are helping you?
Oh, through our makerspace, we've met all sorts of wonderful people. There's Stockton is a small town. The population is relatively large, but it's a tight-knit community. So there's just some different folks that we've gotten involved with who run other local arts organizations they're just wonderful, extraordinary people. And then, specifically through this coalition, not only have we been connected to, Nabil, Catherine, who showed up earlier, and a bunch of other great makers in the community, but some of the volunteers that have come out, I'd like to shout out to Preet and Andor and, a few other volunteer superstars who have been able to, it's incredible to me,
Yeah,
the
that's great.
beauty in people.
Yeah, the volunteerism. I think the volunteerism is the thing that's, really remarkable to see. I think, I think this has redefined how people see themselves as makers and what their capacity is. I think there are a lot of people, Nabil, I don't know if before this you would have identified yourself as part of the maker community or not. Probably you're like, I make some stuff, but, I think it's really sort of changed our identity collectively as a people, and really thinking about how do we create solutions as a community. I wanted to piggyback on something that you said earlier, Dale, about the vulnerable communities. And also reminded of what you said at the beginning of this call, which is Central Valley is really where we get most of our food. And so I wanted to ask Karen in particular, how has the response been as it relates to, farm workers in some of our vulnerable communities that really take care of us? How has the Central Valley been responding to those needs? And, is there an increased need where we all as a community, a larger community beyond the Central Valley, is there a call to action to all of us to kind of help with some of this?
Yeah, absolutely. Thank you for asking that. So we also, since very early on, Congressman Harder has been hearing broadly from the agriculture community. So farmers and agriculture business owners have been kind of aggressively advocating for more access to PPE, because although food, kind of the food supply chain, all the way down to kind of the on the ground farming level, was clearly identified as an essential industry and has been operating with no stoppage throughout this entire crisis. It was not identified as an industry in need of PPE, even though, even under normal circumstances, farm workers and folks who work on farms actually need access to respirators and other protective equipment because of pesticides and dust and other issues in the nature of the work. And so they need that type of equipment under normal circumstances. And then even more so now with our farm worker community who live in tight quarters, who often work in very tight quarters, there's a really critical need. So the congressman had a town hall just a few weeks ago with farm workers, and story after story after story, to be honest with you, I don't have a happy picture here. It's not a solved problem. The stories that we're getting are still stories of gaps and challenges accessing this equipment. The United Farm Workers very recently made a specific ask for us. So if there's anybody out there that can help with this, they made a specific ask for 5,000 masks just for our particular area to meet a critical acute kind of need for our local farm worker population. N95s and the like are ideal, but I think they would also take other types of masks just given the current situation. So there is still an ongoing pressing need because there's still a supply chain challenge here. Things have gotten better. It's a little easier to access things in general, but we still have folks scrambling for these supplies. And in particular, it's very challenging, and I think this is relevant to this conversation, it's challenging for folks to access supplies in quantities that make sense for their needs. If you're a small business, if you're an individual farmer, et cetera, fill in the blank, it's becoming more relevant with reopening. More people need these things, but they can't purchase at the economies of scale that you need to participate in the global supply chain. And thus
That's a really good point.
Local solutions a lot of times to get people.
Yeah, I think one of the things you also, I'd love to hear each of you talk a little bit is, there's still a need for people to get involved. You're still building your network. Adding another printer, adding another person, gets you closer to being able to meet some of those needs. Because I think if we go back 2 months, we didn't think about farm workers. We didn't think about different groups needing this, and to not only get the economy going, but our food security and everything else is at risk if we cannot figure these things out. So I just, Nabil, could you talk a little bit how people, there's two kinds. I live in the Central Valley somewhere and I'd like to get involved. I live outside the Central Valley and I could keep making PPE for you. How do we make those connections possible?
It's very simple. Our website is PRINTtoPROTECT.com. We have a Get Involved page, and from there, individuals can sign up. We have an onboarding team ready to onboard makers, whether they can 3D print, laser cut. We even have a way to manufacture. We have a team, a father-daughter team, Felicia and Mike, who are making face shields manually, so we can train people how to make them. Catherine Falk, who's been laser cutting while we're doing this, she's helping us in the Central Valley from Berkeley. So, it's we're welcoming all involvement, through energy and talent. We set up a nonprofit to accept nonprofit donations and receive community grants. So we're ready to accept whatever help, and it's easy to get involved. Just our website.
Yeah, that's great. And I would guess in terms of the Central Valley PPE initiative, Karen, that if organizations and others want to support this, they should follow up with you and try to get involved as well, right?
Yeah, absolutely. I threw up this little background so that folks can see there's an email address and a phone number, and we are absolutely actively accepting donations. These go directly to our first responders and frontline healthcare workers, and we also are trying to fulfill special requests such as that one I mentioned from our farm worker community.
Yeah, I really liked your point about the global supply chain not being, it's like we can all be in this and we'll have a friend ask us, hey, where do I get a face shield? Right. And you kind of freeze up, right? It's like, well, some group's getting 1,000 of them, but and it might be just an elderly person that wants to go shop at the store, but would feel better protected wearing a face shield. But it's really, I think it's actually we kind of need maker spaces to be storefronts in some cases, and say you could pick up one or two at a time.
I'd like to speak to this because this is a point that comes up for us all the time, is the manufacturing gap between custom artist-made goods and, Alibaba.
Yeah.
So it's really a beautiful thing. Like once we're able to get equipment together, get people who are skilled in training folks running that equipment, this manufacturing gap can be solved across the country on a local level. It's really just, as we're all talking about, leveraging assets and just bringing people and their equipment in the communities together.
Yeah. So it's fascinating in David's talk, for instance, sort of the modifications to the face shield had more to do with the elastics, right? Because there's an elastic shortage, and some of the innovations from the maker community are just working around the failings of the supply chain, that you can't get this, and so you have to do something different or use a different material. It's very, very interesting kind of resilience that we're building here. Well, good. Well, we are coming up on our hour. Let me just see if there's any questions. We have some in the Zoom panel. You could type it into chat. You could come on if you want. We appreciate you all joining us. If you're on Facebook or YouTube, I think you can use that chat and it'll get come over here. But certainly we had one Q&A, really wasn't a question. Shanaz Shothia said, "So proud of all your joint efforts." That's great to hear from different people. Nabil, how has this changed your life? Like what you're used to going to the dentist office and filling cavities and such. Well, how has it changed your day-to-day life?
Thank you for the question. Well, everything's changed, and I think that understanding that everything's changed for myself, you're empathetic to also how we reach out to volunteers and understand the challenges that others have with, the workplace environment we had in the beginning of March is not the workplace environment we have now. We have the day-to-day responsibility to keep our staff safe, to protect our patients, not to be a source of transmission in our community. And then, I always saw it as, as being a dentist, you have the opportunity to take care of someone, person by person in the community. And this was an opportunity to use, resources, just understandings at this time to be of a larger service.
Yeah, great. Dorothy, do you have a closing comment or thought?
Yeah, I want to say thank you to all of you. Each time we meet a group of people on this show, I'm like astonished, and I'm so proud of like the communities that we are. It gives you a lot of hope in humanity that folks can work together in our most difficult of times. And, as someone who is a leader, as is Dale, obviously, of the maker community, I'm just so grateful and just feel such a sense of, pride at the work that's being done. And just, want to say to anyone who's out there who's thinking about, either engaging in these efforts or getting involved with, your local congressional leaders, like, please do so. I think to David's point, he unfortunately had to go, but I think sometimes we get told no. The funny thing about makers is they don't really take no. They just sort of like tilt their head and go back and do something else, and then try a different road. And I think that's pretty remarkable. And this is just another example of that. I think. I
think that's also a characteristic of rural communities too. That they're not always used to getting things that they need, and they have to kind of take it into their own hands sometimes. So I'm always inspired to hear from others. So thank you all for being part of this. Karen, thank you for your perspective, and good luck with the PPE initiative. Thank you for what you're doing. And Nabil, thank you for the Print to Protect Coalition. Good luck. And Elazar, thank you for Hatch Workshop and what you're doing. Let us know, stay in touch. And I think if you need to get the word out that you need something that you're not getting, let us help amplify that a bit. But thank you all, and have a good day. Stay safe.
Thank you. And see you guys at NAMCON. Don't forget NAMCON.org. Hopefully we'll see you guys online next week for Plan C Live on Tuesday, and then at NAMCON the rest of the week. So thank you guys. I really appreciate you
All
having me
right.
here.